Alrighty guys, what's up? Matt Turner back again with another video. And as you can see, I finally got my new splint. I'm so happy to have my hands free and to actually have my fingers available. So quick rundown of how everything went. Um, so after I got discharged, actually before I even got discharged, when I went to my first pre-op appointment on the 22nd, inside of all of the papers that they gave me, the Crane Center already had my hand therapy order form prepared and ready for me. All I had to do was call the company that they were with. Thankfully, my insurance covers. The therapy people that the Crane Center uses is the Ascension Medical Group, and they, I believe, are just a subsidiary of the University of Austin, Texas, because that's where it was. And oh my God, first of all, Austin, Texas University is fucking beautiful. The entire, it's a huge campus, and really state-of-the-art technology and shit. Probably not better than Emory, because Emory is Emory, but they had some really cool stuff in terms of the medical program and shit like that. So that was really cool. So I went there, and I had to call to make my appointment. The Crane Center suggested that I call after my first post-op appointment. It might be different for other doctors. They might give you the hand order as your first post-op appointment. They might give it to you before. I'm not really sure. You might have to ask your individual provider how they're going to go about giving you your hand order. But for me, it was already given in the very beginning. And so then, I don't know exactly why they want you to wait until, the first post-op appointment, but I guess it probably has something to do with the doctor wanting to be able to get a look at the graft site first. I'm almost positive that the Crane Center has been working with this Ascension Medical Group for a really, really long time, because the hand order form they gave me looks really old. Not gonna lie, it's like a copy that's been rewritten over and saved. I can see the save date was from 2017, and then they just kind of fill in my information every on top of the old PDF file and whatnot. So they've probably been working with that group for a very, very long time. And so when I got there, the lady already knew everything. She really didn't have to ask me too many questions, actually. It went by really, really smooth. I called, sent over my insurance information and everything. And then she gave me kind of the check-in information. And then she sat down and she basically, I can still have my ACE bandages, because she did say I can use the ACE bandage with some exercises, which I will go into next. But she took off the ACE bandages, redressed my my graft site, because I have a lot of leakage. As you can see, it's already leaking really bad. And so I'll probably actually have to redress that today. And so she redressed it for me, and then she gave me a sleeve, and she gave me some extra ones at the end as well. But I also brought some socks just in case that I can turn into sleeves, because the way my graft wound is leaking pus is so fast, it's gonna go through all of these. It's not gonna be thick enough. And so then this is a, I can't remember exactly what she said it was, but It's a plastic that basically is malleable under heat. And so it comes flat at first, and then she kind of takes it, makes sure that it'll fit your hand, and then puts it inside a boiling water vat thing that they have, and then kind of pats it down, lets it cool off a little bit, and then molds it to your hand. From there, she kind of, before she did all of that, and like put this on, she did have me try a few exercises, mainly with like straightening my hand, so trying to make sure that I can get it as straight as possible, as well as kind of curling my hand, specifically the metacarpals. And so give me a second and I'll show you guys what I mean. So on your hand, I'm gonna get a little fun exercise science on you guys. So on your hand, these knuckles right here, these are your the knuckles of your metacarpals, and then these are your, I don't want to twist my wrist too much just yet, but these knuckles are this is like the first of your phalange knuckles, and then like the knuckles that make the crown of your fist, so that very, very top arch knuckle, those are the knuckles of your metacarpals. And so she wants me to try and make as much of a fist as I can start making as possible, which I'm getting kind of better at already. I already did a few exercises, and so I'll be doing this, and then she recommended that I can use the ACE bandage that I still have to wrap around my hand, so that I don't have to like try and apply pressure to keep my hand curled. I can use the ACE bandage to kind of hold my hand in that position to have that stretch. We didn't really go over like a ton of like in-depth like exercises or anything like that, like nothing super deep. She kind of just showed me like, okay, you want to try and, you know, do that, get as straight as possible. She wants me to try and do more supination and pronation. So she told me to keep my wrist to my my elbow tucked in, and then turn my hand for supination as much as I can, and then kind of hold that for a few seconds, and then do the same for pronation. I have better supination than pronation right now, which makes a lot of sense because my when I was working out, bodybuilding, most things I'm going to be doing in a supinated grip, so that's what my body is used to. It's also the anatomical position for your body, is actually to have your hands inside a supinated grip versus a pronated grip. And so we went over that, and then she didn't do anything for like massaging or draining or anything like that. She doesn't really seem to, at least her specifically. I mean, she could later on down the road if I decide to go back. But again, there's like aspect of finances in this. So if you have the finances for it, I mean, go for it. But I'm probably going to just do enough to get my hand back in order, and then I will go back to Atlanta and get my own actual physical therapist maybe, because she did mention that I can just come for the one time, get the splint, and then if I wanted to just do these exercises by myself, that's more than fine. And then whenever I get back home, I can find a certified physical therapist, and she gave me her card and a website that I can go to that's credible, that has all of like the different types of physical therapists, and like, you know, like basically like Psychology Today for physical therapy. And so that was that. After that, we didn't do too much. There wasn't a whole lot. And so she did just recommend, you know, make sure to try and start early on your physical therapy. I had been already moving my hands a lot before I even started, because it helped with the swelling in my hand. And also, like, leaving them stiff ended up hurting more. And so that's kind of the mindset you have to have with this, because the longer that you wait off and put off your hand therapy, the more scar tissue you're going to have build up. And so the harder it's going to be. Well, I won't say harder, because I don't know that for sure, but the more energy and time you're going to have to put into, you know, really exercising those muscles. Your extensor muscles and your wrist flexor muscles are very thin, and like, they're strong, but they're not like super duper strong. So like, you got to be patient with them, and you got to take your time. And so that's what I plan on doing. Not too much else. She did tell me that I should start trying to do small things with my hands, such as opening doors, like refrigerator doors, like light stuff. Not really like doing a whole lot with this hand, but trying to get it back in commission, which is what I've been trying to do the entire time. Even when I had my old cast, I would use this hand to like help open bags. I would use it to help pour stuff and everything. I'm of the mindset that when it comes to recovery, if you don't use it, you're gonna lose it. And so that's the mindset I have. And so I try to do as much stuff as I normally can to the best of my ability, and hope for the best normally. But that was my hand therapy. I have heard that some therapists will help with massaging and drainage and everything like that, but I think that's very specific to who your like therapist actually is, and their specializations, because you probably need to have a certain type of certification to do that, or have taken certain courses or classes. So that's that for hand therapy. I hope this did help somebody, because I know for a fact that I didn't see a whole lot of information on hand therapy and how that works. I just remember seeing a lot of people starting with a cast and then suddenly have like a new splint, and I was like, damn, I wish I had that already. So that's how the splint works, at least with the Crane Center. And so yeah, if you have any questions, please feel free to comment. Let me know. I'm more than willing to answer them. Leave a like, subscribe, hit the bell notification button so you guys can stay up to date on when I post videos. And I will catch you guys on the flip side. Look at that. I can do finger things now.